Coronavirus. COVID-19. The 2019-20 coronavirus pandemic is an ongoing pandemic of coronavirus disease 2019, COVID-19, caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The outbreak was first identified in Wuhan, Hubei, China, in December 2019, and was recognized as a pandemic by the World Health Organization, WHO, on March 11, 2020. As of 25 March, more than 440,000 cases of COVID-19 have been reported in more than 190 countries and territories, resulting in more than 19,700 deaths and more than 112,000 recoveries. The virus is typically spread during close contact and via respiratory droplets produced when people cough or sneeze. Respiratory droplets may be produced during breathing, but the virus is not considered airborne. It may also spread when one touches a contaminated surface and then their face. It is most contagious when people are symptomatic, although spread may be possible before symptoms appear. The time between exposure and symptom onset is typically around 5 days, but may range from 2 to 14 days. Common symptoms include fever, cough, and shortness of breath. Complications may include pneumonia and acute respiratory distress syndrome. There is no known vaccine or specific antiviral treatment. Primary treatment is symptomatic and supportive therapy. Recommended preventive measures include hand washing, covering the mouth when coughing, maintaining distance from other people, and monitoring and self-isolation for people who suspect they are infected. Efforts to prevent the virus spreading include travel restrictions, quarantines, curfews, event postponements and cancellations, and facility closures. These include the first, arguably successful quarantine of Hubei, nationwide or region-wide quarantines across Europe, Western, South, and East Asia, Africa, South America, North America, and Oceania, curfew measures elsewhere in China and South Korea, various border closures or incoming passenger restrictions, screening at airports and train stations, and outgoing passenger travel bans. Schools and universities have closed either on a nationwide or local basis in more than 124 countries, affecting more than 1.2 billion students. The pandemic has led to severe global socioeconomic disruption, the postponement or cancellation of sporting, religious, and cultural events, and widespread fears of supply shortages which have spurred panic buying. Misinformation and conspiracy theories about the virus have spread online, and there have been incidents of xenophobia and racism against Chinese and other East or Southeast Asian people. Deaths. The time from development of symptoms to death has been between 6 and 41 days, with the most common being 14 days. By 24 March, more than 16,700 deaths had been attributed to COVID-19. Most of those who have died were elderly, about 80% of deaths were in those over 60, and 75% had pre-existing health conditions including cardiovascular diseases and diabetes. The first confirmed death was on January 9, 2020 in Wuhan. The first death outside China occurred on 1 February in the Philippines, and the first death outside Asia was in France on 14 February. By 28 February, outside mainland China, more than a dozen deaths each were recorded in Iran, South Korea, and Italy. By 13 March, more than 40 countries and territories had reported deaths, on every continent except Antarctica. Estimates of the crude mortality rate by the World Health Organization are 3 to 4% as of March 6, 2020, while the infection mortality rate, the number of reported deaths divided by the number of infections, will be lower. The case fatality rate, CFR, is the proportion of persons with a particular condition, cases, who die from that condition. During an epidemic, the death rate can be affected by quality of healthcare, general health and age profile of the population, while the CFR calculation needs to be adjusted to allow for possible under or over-reporting cases, and for the time lapse between infection and death. Estimates of the CFR vary from 0.2% to 2.3%. Over time, estimates for the CFR in China decreased markedly from 17.3% for those with symptom onset 1 January 10, 2020, to 0.7% for those with symptom onset after February 1, 2020. Signs and symptoms. Symptoms of COVID-19 are nonspecific, and those infected may either be asymptomatic or develop flu-like symptoms such as fever, cough, fatigue, shortness of breath, or muscle pain. The typical signs and symptoms and their prevalence are shown in the corresponding table. The Centers for Disease Control and Prevention, CDC, lists emergency symptoms including difficulty breathing, persistent chest pain or pressure, sudden confusion, difficulty waking, and bluish face or lips. Immediate medical attention is advised if these symptoms are present. Further development of the disease can lead to severe pneumonia, acute respiratory distress syndrome, sepsis, septic shock, and death. Some of those infected may be asymptomatic, returning test results that confirm infection but show no clinical symptoms, so researchers have issued advice that those with close contact to confirmed infected people should be closely monitored and examined to rule out infection. Chinese estimates of the asymptomatic ratio range from few to 44%. The usual incubation period, the time between infection and symptom onset, ranges from 1 to 14 days. It is most commonly 5 days. In one case, it may have had an incubation period of 27 days. Transmission. Details are still being learned regarding how the disease spreads. According to the World Health Organization and the United States Center for Disease Control, it is mainly spread during close contact and via respiratory droplets produced during coughing and sneezing. Close contact is within 1 to 2 meters, 3 to 6 feet. Respiratory droplets may also be produced during breathing, specifically exhaling, breathing out, including talking, but the virus is not thought to be airborne or to spread over large distances. It may also spread when one touches a contaminated surface and then their face. While there are concerns it may spread via feces, this risk is believed to be low. It is most contagious when people are symptomatic, and although spread may be possible before symptoms appear, this risk is very low. The CDC states that the virus seems to be spreading easily and sustainably in the community in some areas. 9. The European Centre for Disease Prevention and Control, ECDC, as of 24 March, notes that there is not enough information about how easily and sustainably the disease spreads, but one person generally infects 2 to 3 others. The virus can remain infectious for hours to days on surfaces such as door handles. Specifically, the virus was found to be infectious for up to 3 days on plastic and stainless steel, for 1 day on cardboard, and for up to 4 hours on copper. This, however, varies based on the humidity and temperature. While the virus does not generally spread through the air, it may survive for up to 3 hours in aerosol form. Surfaces may be decontaminated with a number of solutions, within 1 minute for a stainless steel surface, including 62 to 71% ethanol, 50 to 100% isopropanol, 0.1% sodium hypochlorite, 0.5% hydrogen peroxide, and 0.2 to 7.5% povidone iodine. Benzalkonium chloride and chlorhexidine gluconate are less effective.